Okay, everyone, I'm going to go ahead and mute all the lines. Rachel and Tashara, if you could press #6 to unmute yourselves, that would be fantastic after the lines have been muted. Thank you.
The leader has muted your line. To unmute your line, press #6.
All right. Good afternoon, everyone. My name is Olivia Hensey from the New England QIN-QIO, and I'll be your moderator for today's Quality Payment Program webinar, Measuring MIPS Performance, What's Your Score? The Quality Innovation Network Quality Improvement Organization works with healthcare providers, stakeholders, and communities across New England on data-driven quality initiatives to improve patient safety, engage patients and families, and improve clinical care at the community level. Thank you for joining us for today's webinar. Before we get started, just a few housekeeping items. This call will be recorded for training purposes. I'll provide you with details on accessing the recording at the end of this webinar. The phone lines will be on mute for the duration of the presentation, and we'll take questions at the end of the presentation, and I will provide you instructions on how you can ask a question over the phone or post the question in the chat box. So at this time, I'm going to send it over to Tashara James from the New England QIN-QIO, who will get us started. Tashara?
Hi, thank you, Olivia, for the introduction.
Thank you.
This webinar, Measuring MIPS Performance, What's Your Score, will focus on how MIPS performance is measured and the scoring methodology for each performance category. Next. During the webinar, we will provide a brief overview of the Quality Payment Program and MIPS, Merit-Based Incentive Payment System. We will discuss reporting requirements and scoring methodologies for the following performance categories: quality, improvement activities, and advancing care information. We will also discuss the MIPS final composite score calculation and possible payment adjustments, and there will be a Q&A session afterwards. Next, please. We will be using a lot of acronyms in today's presentation. Some of them are listed here: MACRA, QPP, MIPS, ACI, etc. Next. The Medicare Access and CHIP Reauthorization Act of 2015, or MACRA, repealed the Sustainable Growth Rate formula and created the QPP, the Quality Payment Program. The QPP is a new framework for rewarding physicians for providing higher quality care by establishing two tracks of payment: MIPS, or Merit-Based Incentive Payment System, or APMs, the Alternative Payment Model. Under this program, clinicians have opportunities to receive payment incentives or penalties based on their performance. Next. MIPS consolidates three existing quality reporting programs: PQRS, or Physician Quality Reporting System, VBM, or Value-Based Payment Modifier, and Meaningful Use MEO. And the categories that make up the MIPS final scores are quality, both measures from PQRS, advancing care information, measures from meaningful use, improvement activities, that's a new category, and cost, resource use coming from value modifier. Next. Scores for each performance category will be weighted and rolled up into the MIPS final score. The weights of each category increase in subsequent reporting years. For 2017 reporting period, the categories are weighted as follows: quality, which accounts for 60% of the total score and must report on 6 measures, including 1 outcome or high priority measure. Advancing care information, that accounts for 25% of the MIPS composite score and should report on required base measures depending on the EHR certification year. Improvement activities accounts for 15%, must report on 1 to 4 activities depending upon your practice size. And the final category, weight, for cost is 0% for transitional year 2017, but for the performance year 2, that is in 2018, cost will account for 10% of the MIPS score. Next. Eligibility and exclusion criteria. Now, what practitioners are eligible for MIPS? Physicians, including MDs, DOs, podiatrists, dentists, and chiropractors, physician assistants, nurse practitioners, clinical nurse specialists, certified registered nurse anesthetists are eligible for MIPS reporting. There are exceptions. Exemptions from MIPS include clinicians with their volume of Medicare payments or patients falling below the low volume threshold, that is 100 Medicare patients or $30,000 or less in Medicare Part B charges annually are excluded. Similarly, clinicians in their first year billing Medicare are also excluded. Again, clinicians who qualify for a bonus payment under advanced APMs are also excluded. Next. Pick your reporting pace. To ease the transition to MIPS, CMS has introduced Pick Your Reporting Pace options for 2017. The options are Don't Participate, that means eligible clinicians who fail to report any data to CMS will be subject to the full negative payment adjustment of 4%. Test Pace. Report at least one quality measure, one improvement activity, or the required base ACI measures and avoid the negative payment adjustment. Partial participation. That is, report at least 90 days of data for more than one quality measure, more than one improvement activity, or 4 or 5 required ACI measures, and avoid the negative payment adjustment and may earn a small positive adjustment. You can start reporting any time between January 1st and October 2nd, 2017. And the last one is full participation. Report for a full calendar year for 6 quality measures, 2 to 4 improvement activities, and all required base ACI measures. Full participation optimizes an eligible clinician's chance for moderate positive payment adjustment in 2019. Next. MIPS scoring methodology. Now I will hand over to my colleague Rachel Crowe for more in-depth discussion on MIPS scoring. Rachel?
Thank you, Tushara. So now I'm going to walk you through the MIPS scoring methodology, and we're going to go category by category. We're also going to talk a little bit about how this overall composite score can translate into a payment adjustment for the payment year 2019. So the majority of the scoring that we're going to be talking about is going to be that full participation or the 90-day reporting period. We'll talk a little bit about some of the pick your pace options as well, but we're going to mostly focus on if you're submitting for a 90-day or full period. So the first category we're going to talk about is the quality category, which we mentioned is 60% of the final score in the transition year. So requirements for full participation in this category would be selecting 6 of approximately 300 available quality measures and reporting data on a minimum of 90 days. So you also have the option to select a specialty set, which may include greater than 6 measures or less than 6 measures. If the category has less than 6 measures, then you're only required to report the measures within that specialty set. You can also opt to report through the CMS web interface measures. And then there's also a readmission measure that's going to be calculated by CMS for groups that have greater than 16 clinicians and sufficient cases. So sufficient cases would be greater than or equal to 200 cases. So clinicians can receive anywhere between 3 to 10 points on each quality measure that they submit, and that's based on performance against benchmarks. So if you are doing the pick your pace reporting for the transition year and you choose to just submit one measure at one point in time to try to avoid a negative penalty, you can just submit that one measure and you could receive the minimum of 3 points. Okay. And then failure to submit any performance data for a measure would be 0 points.
And in this category, like a few of the other categories, there are bonus points that are available. Okay, so a little bit more about receiving points for measures. So year 1 participants automatically receive 3 points for any measure that they submit for, regardless of performance and regardless of the amount of data that you actually are submitting. But you can earn more points based on performance if there's a benchmark available. So we'll talk more in depth about benchmarks because we do get a lot of questions about those. So if a measure can be reliably scored against a benchmark, then a clinician can receive anywhere between 3 and 10 points. And so reliable scoring would be if there's a benchmark that exists, also if you're submitting a sufficient case volume, which would be submitting at least data on at least 20 patients for most of the measures, and then also the data completeness is met. So this is a little bit different than PQRS. So this would be at least 50% of possible data is submitted for this particular measure. So if a measure cannot be reliably scored against a benchmark, being there is no benchmark available, so some of the measures there aren't benchmarks to compare your performance to, you can just receive that 3 points for submitting the measure. Okay, so a little bit more about benchmarks. So you can go to the qpp.cms.gov website to learn more about the benchmarks or download a CSV file that shows all of the different benchmarks for each quality measure. So there's different benchmarks depending on the reporting mechanism. So EHR reporting, claims-based reporting, they all have different benchmarks. So I would encourage you to go to the QPP website to take a look when you're determining which quality measures you want to submit for, because you're going to be able to estimate the amount of points and where your performance lies based on those benchmarks. And so the benchmarks are created based on all reporters. It's not separated into practice size or specialty. They're all combined into one benchmark. And like I mentioned, there aren't necessarily benchmarks for every single quality measure. They are looking to create new benchmarks, and in order to do that, they need at least 20 reporters, and there's specific criteria that needs to be met. So they need to meet or exceed that minimum case volume, which in most cases is 20 patients. They need to exceed or meet the data completeness criteria, again, which is 50% of possible data being submitted. And the performance in that particular category has to be greater than 0%, unless it happens to be an inverse measure, which it would have to be less than 100%. Okay, so this is taking a look at benchmarks. So if you were to go to the QPP website and download the file on benchmarks, this is what you're going to see. So, for example, you see the measure name. This one is diabetes, a hemoglobin A1C, poor control. And we know that this is actually an inverse measure because you want the majority of your patients to be in control. You don't want a high number to be in poor control. So for this particular measure, for this particular benchmark, we're looking at a claims-based benchmark. And so if you go down to the right-hand side, you can see it's separated into different deciles. So those deciles are based off of your numerator and denominator, so basically your performance. So as you can see, as you get a smaller number, so less of your patient control, you fall within a high.
Hey, Rachel, it's Olivia. You're cutting out a little bit. Rachel, are you there?
Olivia?
Yes, Leela.
Do you want me to continue?
Would you mind? Maybe Rachel will hop back on. Unfortunately, I think maybe she lost connection or something. That would be great. Thank you, Leela.
Sure. Can you give us the ball so we can advance the slides?
Rachel has the ball. Hey, Emily or Jennifer from WebEx, would you mind giving Leela the ball? Looks like Rachel. Oh, perfect. Okay. Looks like you have it. Thank you, Leela.
Sorry, everyone. So I'll just skip to the next slide. So as Rachel mentioned, there's decile scores that come for each of the quality measures that you're potentially reporting on. This is a quick slide to show you how those deciles fall and the number of points you can potentially earn. So as you can see, if you were to fall into the decile 6 group, you can get between 6 and 6.9 points. If you're at the lower end of that score, you would probably get closer to 6. If you're at the higher end, you would get closer to 7 points up. There's bonus points you can earn for each quality measure. If you submit any additional high priority or outcome measures, you can get 1 or 2 points for each of those. There is, as Rachel mentioned, a requirement to have at least one outcome or high priority measure in your 6 measures that you select, so anything outside of that you would get bonus points for. If you report using your certified EHR for all of your measures, you can get 1 bonus point per measure you report for using that EHR. They call it end-to-end reporting. That means that you're not doing any manual abstraction. That data is automatically pulled right from the EHR and sent to CMS. This is how the quality score is calculated. The total points per measure, that's following the decile score, any bonus points you might earn, and that's divided by the maximum points you could earn for the category. So if you're in a group of 15 or less, the maximum points is 60. If you're in a group of 16 or more, the maximum points is 70 because there's that all-cause readmission measure included. If you're in a larger group or using the web interface, you actually need to report on some additional measures. If you use the web interface, it's 15 total clinical quality measures. As you can see, that's 120 points. Groups that are reporting that don't have that readmission measure is 110 points. And as I mentioned, for the 15 and under groups, that's 60 total points because you don't have the readmission measure. And if you're in 16 and above, you have the readmission measure, so 70 points. So we have a quick question for you to test your knowledge thus far. If an eligible clinician scores a 78 out of 97 on the pneumonia vaccination status for older adults measure, and they submit that using EHR Direct, what's their performance score currently, and what performance decile do they fall into? So as Rachel mentioned, this is a quick screenshot of the decile scoring. Take a look, test your knowledge, and I will show you the answer in just one moment. All right, so a 78 of 97 is an 80.41%, and based on that measured decile scoring system, they reported EHR Direct, so they would fall in the 9th decile. And again, because they're towards the higher middle range of that decile, they would get about 9.5 points.
Hey, Leva, it's Olivia. I think Rachel is back on the line.
Great.
Thank you so much for taking over. Rachel, are you there? Just spoke with her. Sorry to everyone.
Sorry. I'm here. Can you hear me now?
We can. Thank you. And thank you again, Leela.
Absolutely.
Okay. So, I'm sorry. So just to pick up where she left off, I think she explained this slide, but as you can see, yes, she did explain this slide. Okay. Sorry to everybody that's listening. Gotta love all the technical issues that we can come across. Okay, so this next question number 2, and again, type your answer in chat. An eligible clinician in a group of less than 15 reports on 4 outcome measures and uses their certified electronic health record for end-to-end reporting on all 6 quality measures they submit. So how many bonus points would they earn? So if you can determine that, please type your answer in chat. All right. So I'm not seeing too many answers, so we'll just move ahead. Except, okay. All right, so the answer, so with this, you're reporting on an additional 3 outcome measures, and like we had mentioned, with the outcome measures, you can get 2 bonus points per measure, so that would be a total of 6 bonus points. And with the end-to-end reporting, you would get 1 bonus point per measure, and they used it for all 6 measures, so that would be an additional 6 bonus points for that bonus category, giving a total number of 12 bonus points earned. All right, so that completes the scoring for the quality category, and now we're going to move on to improvement activities, which is a little less complex. So as we mentioned, improvement activities account for 15% of the final score. You can earn a maximum number of 40 points, and there are over 90 improvement activities in a variety of different categories that you can choose from. So each activity has a specific weight designation, so it could be designated as a medium weight category or a high weight category. And typically a medium weight category, you would earn 10 points. In a high weight category, you would earn 20 points. There are alternative weights for clinicians in small, rural, or underserved practices, or those that are non-patient facing, so the points would actually double in those categories. And you can look online, again, on the QPP website to see which weight each specific activity would be worth. And then also, certain clinicians will earn full credit for this category. So if you're part of a patient-centered medical home, a medical home model, or a similar specialty practice, you'll earn the full 40 points. And for this year, current APMs, you will earn the full points. So if you're part of a Medicare Shared Savings Program or the oncology care model, you'll also earn the full 40 points for this year. Okay, so the scoring for this category, to figure out your overall improvement activities category score, you would obviously just take the total number of points that you earned for your completed activities divided by the maximum number of points, which is 40. And the score can't exceed 100%, so if you do extra improvement activities, you can't get over a 100% score. So here's another question. So again, if you can type your answer in chat if you know the answer. So an eligible clinician works with the New England QIN-QIO to implement antibiotic stewardship in their practice as well as diabetes self-management education for their diabetic patients. So how many improvement activity points will they earn? And we gave you a little hint that both of these activities are medium weight activities. So how many activity points would they earn? So I see 20 points. I'll give just a couple more seconds if anybody else wants to type in what they think the answer is. All right, so moving forward, again, both antibiotic stewardship and diabetes self-management programs are medium weight activities, which would earn 20 points, 10 points each. And so also these are programs that we actually are helping practices with, so if it's something that you want more information on, you can contact us after the presentation. Okay, so here is another question. So looking for some keywords here. A small group of eligible clinicians select participation in transforming clinical practice initiatives as one of their improvement activities. So how many more activities will they need to attest to implementing in order to get full credit? And another hint, this QPPI is considered a high-weight activity. And again, I just wanted to reiterate that we are recording this webinar, and it'll be available, the slides will be available if it's something that you want to go back and look at later. You know, sometimes it's hard to answer questions right on the spot, so, okay. So I see a couple of answers, and those are correct. So they don't have to attest to any more improvement activities. They've already met the 40-point maximum. So the key here is that they're small and rural eligible clinicians. Those will get double points. And since the QPPI category or the QPPI activity is a high weight activity, which normally would earn 20 points, it would double to 40 points. So they've reached the maximum 40 points. Okay, so moving on to advancing care information. So we do get a lot of questions on this category, and it's a little bit more complex than the improvement activity. So I'm going to try my best to explain it in a way that everybody can understand. So there are 3 different categories for scoring in the advancing care information section. Overall, ACI accounts for 25% of the final MIPS score. And the categories are, there's a base score, a performance score, and a bonus score. So this slide is talking about the base score. So this more or less is an all or nothing category. So clinicians must submit a numerator and denominator or a yes/no response for each of the required measures, and you can choose from one of each of these measure sets. So these on the left-hand side, you see advancing care information measures, and those are based off of EHR technology certified to the 2015 edition. And then there's the 2017 transition measure set, which is for those EHRs that are certified to the 2014 edition. So essentially you have to submit information on each of these measures, and failure to submit on one of the measures within the measure set would actually result in a 0 score. So it's all or nothing for the base score. And also, furthermore, if you're not able to meet the base score, you'll get an overall 0 score for the advancing care information category. So it's important to take a look at this category and see if you are able to meet the base score, and if not, you won't be able to get any points for the performance or the bonus score. And again, if you're doing the test pace, the pick your own pace for this particular category, and this one category you want to submit for is advancing care information, you would have to submit all the measures within a measure set and complete the base score in order to get that score for the pick your pace. Okay, so moving on to the performance score. So this gives you the option or gives you the availability to earn more points based on adding additional measures and performance on those measures. Again, there's a number of similarities between the different measures, but they're based off of the 9 measures are based off the 2015 cert, and the 7 measures are based off of 2014 cert. So there's just a few slight differences. So you can get additional percentage points based on your performance rate. So you would submit one of these measures, and then you would determine your performance rate, and you would take a look at this table on the right-hand side, and based on where your performance falls, you would add additional percentage points, or you would earn additional percentage points per measure. So, for example, if you're submitting a measure and your performance rate is in, say, the mid-60s, you get an additional 7%. So you would take a look at this table for all of the additional measures that you're submitting and would add it up, and that would be your performance score for the ACI category. And so there are actually a couple of measures that will give you double the points on this table, and those include the providing patient access measure and the health information exchange measure. But you can get more information on those measures either through emailing us or from the QPP website. So then there's the bonus score. So you can get 5 additional percentage points for reporting through a public health registry or clinical data registry, electronic case reporting, and you can also get 10 percentage points for using CERT to report some certain improvement activities. So you can get up to 15 percentage points bonus for the advancing care information category. So then you basically just have to look at all the scores that you got within the base score, the performance score, and the bonus score and add them up. So the base score, again, is going to be either 0 or 50. So if it's a 0, you know that the overall score for this for the ACI category is going to be a 0. If you succeed and get the 50%, then you can just add whatever you had scored within the performance category and the bonus score. And again, it's going to be capped at 100%. Okay, so we're at another question. So again, type your answer in chat. So an eligible clinician reports the following on the required base measures. So they said yes to the security risk analysis, 100/136 for e-prescribing, 0 out of 17 for provide patient access, and 2 out of 19 for health information exchange. So will this EC meet the base requirement? And I do see some people that are typing in chat, and you are correct. So no, they will not meet the base measurement requirements because they answered at a 0 numerator in the provide patient access category, and you have to at least have 1 patient in the numerator to meet the reporting requirement. Okay, so question 6. So this one's a little tricky if you don't have that table in front of you, which most likely you don't. So we'll kind of just walk through it. So a group of eligible clinicians report 625 out of 723 on provide patient access using a 2014 certified EHR. So what is their performance rate, and what will their percentage score be? So I'm just going to jump ahead. So their performance rate, again, you're just going to divide that numerator by the denominator, and you're going to get the 86.45. So then looking at that table I had referenced, you'll see that their performance rate falls between 81 and 90. So they're going to get the 9 percentage points, or they would get the 9 percentage points if it were a normal measure. However, this particular provide patient access measure is actually one of the measures that you get double the points for. So then you would double it to 18 percentage points. Okay, and so now that we've talked about the advancing care information category, we can't completely leave out cost. However, in terms of your MIPS score for this transition year for 2017, it does not affect your overall score. So 0% of the final score. But again, as we mentioned, it's going to be 10% of the final score next year. So it's important to be paying attention to this category as well. So there's no reporting requirement. Clinicians are assessed based on Medicare claims data. And even though this isn't weighing into the final score, CMS is still going to provide feedback on how you perform so you have an idea of where you might need to focus moving forward. So it won't affect your 2019 payment. And so they determine this based on previously used physician value-based modifier measures and those measures that are reported in the Quality and Resource Use Report, also known as the QRUR. So we do encourage you to download it and take a look at your QRURs to get an idea of what those types of measures are looking at. Okay, so putting it all together. So we've talked about how to find out your score for each of the 4 categories. And then you just need to put it all together. So you would take your performance score for each category and multiply it by the category weight. So then you would add those all together, multiplied by 100, and that will give you the final MIPS score. So we're going to walk through an example just to demonstrate how that's done. Okay, so again, the best way to do this is to kind of look at each category and figure out your score within each category and then combine them. So an eligible clinician earns the following scores. So they earn 45 out of 60 in quality. They earn the full 40 points in improvement activities and 75% in the advancing care information category. So what is this eligible clinician's final MIPS score? Okay, so 45 out of the possible 60 points would give you 75% out of the quality category. So you take that point as you can see on the bottom, and multiply it by the 60%, which is the weight of the quality category. So for improvement activities, you're getting a full 40 out of 40 points for 100%. So you take that 1 and multiply it by the category weight of 15%. And then advancing care information, you're getting 75% percentage points. So you would take the 0.75 and multiply it by the category weight of 25%. And again, we have the cost category crossed out because it's a 0 percentage weight for this transition year. So once you add all those together, you get a final MIPS score of 78.75%. And so we have one more example, and this kind of reminds me of a problem-solving example from back when we were in school. So we'll walk through this one as well. I don't expect you to know it off the top of your head, but I would definitely encourage you to, print these slides off at some point and, use them as a reference. So example 2, so an eligible clinician within a patient-centered medical home of less than 15 clinicians submit 6 quality measures, but they are unable to achieve data completeness for any of the measures. The same clinician met the reporting requirements for the ACI-based measures, and they submitted 2 additional ACI performance measures with performance rates of 35 and 60. So we're going to just break this down a little bit. So looking at the quality category. So this particular clinician submitted 6 measures. However, we stated that they didn't reach data completeness for each measure. Therefore, they would only get the minimum of 3 points for each measure. So that would give them 18 out of a possible 60 points. Also, we know that the readmission measure wouldn't come into play here because we mentioned that there are less than 15 clinicians in this particular practice. And then now that we've seen what the score is for quality, moving to improvement activities, we mentioned that they're part of a patient-centered medical home, so that would give them the full 40 points out of 40 points. And then advancing care information. This particular practice met the base, or this clinician met the base score at 50%. And then they also submitted additional measures, which if you had the table in front of you, that you can determine the additional percentage points based on that performance rate that they had. So we had stated that the performance rate for the additional measures that they submitted was 35 and 60, which would give an additional 10 percentage points for the ACI category. So that's a total of 60% for that category. So then, again, you would multiply by the weight of each category and add everything together to come up with the final MIPS composite score of 48%. And so what does this final score mean? So we know that in order to get a payment adjustment, whether it's negative or positive, you have to look at your overall performance score. So for the 2017 transition year, if you do nothing and get 0 points, that's how you're going to get a negative payment adjustment of -4%. So if you do something, you submit 1 measure, and that pick your PACE option, and manage to get 3 points, you'll have a neutral payment adjustment. And so this table is for the 2019 payment year. So you can kind of estimate a little bit on whether you're going to get a neutral adjustment, negative, positive, or positive with an exceptional performance bonus as well. So if we think back to those 2 examples that we just gave, the first example that we did, the performance, the total composite score was 78.25%. So if you were to score 78.25, you fall within that category that would be eligible for the positive payment adjustment in addition to the exceptional performance bonus, which is another pool of money available. And the second example that we gave, the clinician scored a 48% for his final score. So he would still get a positive adjustment, but he wouldn't quite be eligible for that exceptional performance bonus. And so this last slide is just a graph of what the MIPS payment adjustment factors look like based on your final scores for the 2019 payment year. So you can see that there's this performance threshold line, which equals 3. So that's where it is set. The performance threshold is set for this first transition year, which means if you get 3 points, you are neutral, you avoid a negative payment adjustment, but you don't get a positive payment adjustment. In the coming years, that performance threshold is going to change, and it's going to change based on a budget neutral performance. So the matured, so you're either gonna fall below it or above it. There's not going to be that many people that fall right on the performance threshold. If you do get a neutral payment, but that's essentially the number of points that you would need to get to avoid a negative payment adjustment. And then you see at the far right, there's that additional adjustment factor, so that's at the 70 points, which if you fall within that category, you'll get the positive payment adjustment in addition to the exceptional performance incentive. And so I know this is a lot of information, and sometimes when you're doing math, it can get confusing, especially over a webinar. Again, this webinar is being recorded and it'll be available on our website. We also have a number of other resources, and we have devoted staff in each state, so I encourage you to contact one of us if you have additional questions. The CMS's Quality Payment Program website is also a great resource, so if you haven't been on that website, I would encourage you to take a look at it. You can look at the quality measures, improvement activities, and more information on the Advancing Care Information category. And so with that, we would like to open it up for any questions that you might have. And thank you for listening in. Yep.
Thanks, Rachel. It's Olivia again. Thanks for a great presentation. As she had said, we'll take some questions at the moment. If you'd like to ask a question, you can pose your question in the chat box. Just make sure that you send it to all participants. Or if you would like to ask a question over the phone, you can press #6 to unmute your line. That's #6. Rachel, it looks like there is a question from Sandra O'Brien. I practice at multiple locations reporting under 2 different TINs. How will my performance be scored? Do I need to participate and report for both TINs?
Hi, Olivia. I can answer that one. So, Sandra, the first question would be, under each TIN, do you meet the low volume threshold that Tashara had mentioned earlier in the presentation? If either of those TINs falls below the threshold, then you would be excluded at that location. If it's above the 30,000 in Medicare claims and 100 patients, Medicare patients annually, you would need to report there. So depending on where you fall in the inclusion or exclusion criteria, you would need to adjust your reporting. And in terms of being scored, again, if you're reporting, you would fall under those same decile scores that Rachel had mentioned based on the measures you select at each of those locations. So a little bit of a bookkeeping, tracking quandary you have, but if you have really good records, we can help you out with that as well.
Thanks, Leila. Looks like I have a few more coming in. I know that Lisa Greenland had asked, Rachel, can you describe the QPP support services available, cost?
Yeah, so we have a number of services available throughout the region. So we have dedicated staff in each state, and we offer technical assistance, one-on-one education or assistance. Our services are completely free of charge. We offer, again, we do these webinars monthly. We have a number of resources available on our website. You can submit questions if you just have one general question, and we'll get that to the appropriate person within your state. So there are a lot of different resources, including individualized help with selecting quality measures, looking at your performance, or just general QPP questions.
Thanks, Rachel. We have one more question from Joan. Would her data be included in either of the practice locations reported as a group?
I'm thinking, Joan, are you referring to the group reporting under multiple TINs?
Joan, you can press pound 6 if you'd like to talk over the phone, or if you want to continue chatting in the chat box, that's fine as well. Okay, looks like I'm not referring to the previous scenario.
Yeah, so if each TIN is reporting as a group and they both meet the inclusion criteria, so again, 30,100 Medicare beneficiaries annually, then yes, that provider's data would be included in both of those groups if they're reporting as a group.
Thanks, Leela. Does anyone else have a question or would like to make a comment? Again, pound 6 to unmute your phone line, or you can pose a question in the chat box. While we're waiting, Rachel or Leela or Tashara, does anyone have any, looks like Joan has another question. Even if she doesn't exceed the low volume threshold as an individual?
Yes, so if a practice reports as a group, any of the clinicians within that group, even if they don't exceed that low volume threshold, would be included in reporting for that group. The only time a group would be excluded is if everyone in that group was excluded.
Hi, this is Dan Kennedy. Can you hear me?
Yes, we can.
Yeah, I sent a question, but it was during the presentation. I just wanted to clarify information that I was presented, and that's for the ACI component. There could be a maximum of 155 points, and if you're reporting as a group, that will benefit the group. I understand it's capped at 100, but if you have poor performers in your group, you potentially could offset that with a capped out score of 155.
Absolutely, yeah. If you have performers that are doing really well and they get close to that 155, and you have some that are falling well below the 100, as you mentioned, the 155 performers can definitely pull up those lower performers.
Right, and in particular for those physicians in an MSSP Track 1 ACO, where the ACI component stands alone, that can't report under the ACO directly, I think it has a huge impact on those practices.
Yeah, and you bring up a great point. So under the Medicare Insured Savings, that also is weighted by the size of the group that's reporting. So a group that maybe isn't performing as well, that's small. If there's a larger group that's reporting, then their score would help. If it's a large group not performing well, then obviously they could actually have some pretty detrimental effects on the overall score of the ACO.
All right. Thank you.
Absolutely.
Leela, did you see the question? It's MD participating in ACO group. Do we still have to report before 10/2017? Has that been answered already? I'm sorry.
It hasn't. 10/2017, I'm sorry, but I'm not sure what date you're referring to.
If you would like to, before October 2017?
So ACOs report for the full year, so you wouldn't report until the beginning of next year.
I think the October 2017 date may be in reference to the last full 90-day reporting period. So
good point.
I think October 2nd would be the last date to fulfill the full 90-day reporting period. Great, thanks, guys. Again, please feel free to continue asking your questions in chat. You can do it over the phone. #6 to unmute your phone line. Leela or Rachel or Tashara, as I was saying before, is there anything else you guys would like to add before we wrap up today? Any closing remarks or statements?
I guess I could just say, well, one, thank you for attending. Two, look for additional webinars that will be in the coming months. Three, I apologize for our technical difficulties. And also, again, I encourage you to check out our website for more information. I did type that into the chat box so you can see, you can directly link in through there. And also, again, the QPP.cms.gov is going to be a great resource if you're looking for quality measures, improvement activities. And it's actually a really nice, easy-to-navigate website as compared to some of previous CMS websites. So I would definitely encourage you to take a look at that.
Thanks, Rachel. Leela or Tashara, you guys all set?
Yeah, I just want to reiterate what Rachel had said. Thank you all for joining us, and please tune in for future webinars and contact us if you have any questions.
Thanks to everyone, and again, thank you, Rachel, and to Leela, and to Tashara. It was a great presentation. I want to thank everyone for a great discussion. I just have a few last-minute announcements before we end the call today. When you close out of this webinar, the evaluation will automatically pop up on your computer. If you could please fill that out, we would really appreciate it. If you don't have time to fill out the evaluation right now, or you're currently sharing a computer with someone else, you'll receive an email tomorrow morning with the link to the eval, as well as the link to the event page on our website. The PowerPoint presentation was in your Day of Details email, and it is posted on our website. And within the next few business days, our recording and a transcript of the webinar will also be added. Thanks again to everyone, and I hope everyone has a fantastic day. Thank you.
Thank you very much.
The leader has disconnected. The conference will be terminated in 5 minutes.